Hello and welcome to the special Q&A with Dr. Mario Elia from the London Lambeth Family Medicine Clinic. Dr. Mario will be answering your questions submitted to our Facebook page at RTV London. Hello, Dr. Mario. Can you give us some background on who you are and where you practice?
Thanks, Vanessa. I'm a family doctor in London. I'm at the London Lambeth Family Health Organization, and I'm the lead physician at that practice.
Should the general public be wearing masks? We're getting mixed information on whether it's helpful or not during this pandemic.
So this is a question we've been getting a lot, especially over the last week or so, with a lot of stuff on social media and in the press, people talking about should the public be wearing masks or not. And this is a fairly complicated question with a lot of questions around what the evidence truly is for this. So I'll make this as simple as possible as I can for people. We currently have a shortage of surgical masks and N95 masks for healthcare workers. And for people in the community, there's not really solid evidence that wearing a mask on a regular basis will decrease either the risk of getting COVID or the risk of transmitting COVID. There's very, very slight evidence for a decreased risk of transmitting COVID to others, but it's fairly weak evidence. So what I've been telling people is that if you want to wear a homemade mask, there's probably nothing wrong with it, provided that you understand there's a good chance that it's doing nothing for you, and we need to be very careful that it doesn't actually change our behavior in any other ways, because my concern is that people will start wearing masks and get a false sense of security that mask is actually either protecting them or protecting others, where we really can't say that. And the other thing too is that we want to make sure that if people do feel somewhat safer wearing a mask, that they're doing nothing to reduce the supply for healthcare workers, because that's, again, a critical issue right now. So again, if people want to wear them, I'm not going to discourage people from wearing them, but it shouldn't make them feel any more safe when being out. And we still need to be really careful about physical distancing and not taking any unnecessary risks.
Are homemade cloth masks okay to wear out in public, getting essentials or going shopping?
So along the same lines, if someone is going to wear a mask, we would hope that they would save surgical masks and N95 masks for healthcare workers, and if they have a stash somewhere that they've loaded up on, that they consider giving that to their local hospital. And if they do have a homemade mask, then again they can wear it. But that they not take any unnecessary chances just because they have a mask on.
Do you think we in Ontario, in Canada, are doing enough when it comes to social and physical distancing? Or do you think now it's time for a lockdown, now that the virus is known that it's community spread?
So I think that the measures that we've taken so far, both in London and through Ontario and Canada, have been appropriate. I would argue some of the changes may have been a few kind of days late, but we may be nitpicking at that point. But I think we've taken some good steps. I think with some of the spread that we might see over the next week, we might see some further measures implemented in the community. But by and large, I've been largely content with some of the measures that have been taken to reduce the risk of transmission in the community.
Take us through the definition of community spread, and why is the virus so amplified when it gets to this stage?
So this is a good question about community spread, because when we initially saw our first cases of COVID-19 in Canada, they were all from returning travelers. And the question was, well, when would this become community spread? So what that means is that someone got it from somebody who wasn't an identified high-risk person because of their travel history. So the reason why this is the most concerning is that there's a lot of patients who are presenting now where we can't actually figure out exactly where they got it from. It was someone that they came into contact with that they didn't know had symptoms. It was someone when they were out at, not to label the grocery stores, but somewhere in the community that they were exposed to this. So that carries a different layer of concern that we just can't, we're quarantining everybody who gets back from travel for 14 days because that's absolutely vital. But we know that that's not going to be sufficient to reducing the spread beyond that. So that's where we've been seeing this community spread over the last few weeks.
What changes have been made at your doctor's office now as a result of COVID-19?
So COVID-19 over the last few weeks has been hugely transformative in our practice. We've had to implement a drive-through of sorts for patients who have either had a travel history or have respiratory symptoms, really to protect our staff from being exposed to anybody who could be either symptomatic with COVID, like with symptoms, or an asymptomatic carrier, because we know that there is a portion of people who, before they have symptoms, potentially have the virus in their system. And there's a chance with those patients, albeit not as high as someone with symptoms, but asymptomatic people, there is a risk of them transmitting it as well. So we've made some changes in our office to try to protect our staff and have as limited contact with patients as possible for our staff. So we've implemented a drive-through. We're doing 90+% of visits virtually, which is a change in our office as well. So we're doing a lot of visits by phone, by telemedicine, so by video. And that's really long overdue for a lot of us that we've often talked about implementing some of these new technologies. So this has kind of pushed things forward there, but certainly COVID has had a huge impact on our practice.
What type of screening do patients need to go through now prior to entering your clinic?
So in the last few weeks, we've implemented a policy at our clinic where we actually have our front doors locked, and that patients actually have to call in for an appointment or to contact us in any way. So when anybody calls our office for an appointment or for any advice, the first thing that they're asked is whether they have any travel history, whether they have any symptoms, and our staff has been great about asking kind of triaging questions to be able to identify patients who need to come to the attention of the doctor more urgently.
Is it still safe to visit your family doctor?
This is a great question because one of the biggest risks to the COVID situation we're in now is that people with issues that are urgent or emergent don't seek care because they're afraid of either bothering their doctor or going to emerge and getting sick and emerge, or going to their family doctor's office and getting sick by waiting in the waiting room. And we want to make sure that when people actually have illnesses that they would have sought medical care for before, that they're still reaching out to either to their family doctor, because we want to make sure that we're not neglecting things that need to be addressed, because that can be a definite unintended consequence of the COVID situation. So again, if you would have contacted your family doctor for what you feel is an urgent or an emergent issue before, don't hesitate to give them a call, because nearly all family doctors in London are still in their offices, still open to seeing patients when needed. And we want to make sure that patients do know that they can contact us when they need to.
Have you switched over to virtual appointments? And if so, what does that look like?
Yeah, so our office, like many others in the London area, have switched a lot of our appointments to virtual appointments. So it's dependent on what clinic you're part of. But in our office, the majority of visits we're just doing over the phone. So those are fairly standard. Most people have a phone. We also have a video conferencing app that we've been using, where we send the patient in. So if we talk to the patient on the phone and we feel that we actually need to see them virtually to get a sense of what's going on, we're using an app called Reacts, which we send the invite to the patient. They download the app. They're part of our contact lists, and then we would reach out to them via the app. We would have a video conversation like this to address whatever issue they have. So that's what we're doing in our practice for virtual. Some other offices are using different apps, like OTN is another app that's used, and some are doing exclusively phone. So it's a different mix depending on who your doctor is.
In your professional opinion, how bad could this pandemic get? And how do you think London is currently doing with the social distancing?
So certainly we're seeing things in the news from across the world and down in the U.S. with escalating cases of COVID and ultimately deaths. In terms of how I feel we're doing in London, I think we're doing reasonably well in terms of physical distancing. Obviously, there's still some bad actors and some people who aren't taking this as seriously. And certainly if these are your friends or your family, please don't hesitate to be extra firm with them and really letting them know about the seriousness of this, because we have seen deaths in the London area already, in St. Thomas, Sarnia, Windsor. So we're starting to see this ramp up. We're starting to see more and more patients in ICU. So this is certainly a serious issue. And how bad could this get? It's tough to put kind of a number on it. And I do think Canada, and specifically Ontario, and especially London, won't be hit, I don't believe, hit as hard as other areas, but that's not to make us complacent in any way. The success that we have with this will be dictated by how seriously we take this over the next few weeks and how well we do in terms of physically distancing, narrowing our not being in groups of the province has said more than 5, but really the smaller the better with how many people you interact with on a daily basis. Because again, every little bit helps with limiting the spread of this.
As we continue into week 3 of social and physical distancing, what are your concerns around mental health? And when should someone see a doctor, if that is even possible at this time?
So this is absolutely critical with people who are being physically and a lot of times socially distanced from those. And these are people who may have had a mental health issue before or having a new onset of a mental health issue. And what I would say is if you have any concerns at all, regardless of the severity, please don't hesitate to reach out to your healthcare provider. We can give you some guidance on resources that you can be in contact with. We can give some professional advice about counseling, about pharmacologic therapy, about pretty well anything. And we want to make sure that as the weeks go by, that we're not neglecting any kind of early signs of either depression, of anxiety, of grief in some cases where some may be losing loved ones. So we want to make sure that you're reaching out early and often for any issues about mental health.
It's very hard to find any disinfectant wipes, hand sanitizers, and the products that people need to stay healthy right now. So how are people, the general public, businesses, supposed to keep themselves safe when none of these products are even available at this time?
So one of the best ways to clean our hands, to clean surfaces, is still soap and water. And that involves not only using the soap and water, but actually giving a good scrub, because the scrubbing mechanism that actually wipes away the viral particles and the things that actually would potentially cause COVID. So again, don't worry if you can't find the latest and greatest hand sanitizer. If you can't find disinfectant, again, soap and water is often a very good solution.
Okay, avoid ibuprofen, yes or no? Because we are getting mixed signals on this one.
So this has been talked about a lot in the last few weeks about anti-inflammatories like ibuprofen, the brand name Advil, or naproxen, the brand name is Aleve, and whether these are safe to take. So there were some reports out of France, and the French health minister came up with some comments that they were seeing higher rates of people doing poorly in their ICUs who were on anti-inflammatories. Now, I can put your minds at ease that if you are on an if you're on an anti-inflammatory for issues right now due to pain or anything you've been prescribed it for, we would advise you not to stop that for the most part. The European Medicine Agency has also put out a statement that there's no convincing evidence in anything published that there's anything particularly to be concerned about with anti-inflammatories. Now, that being said, Tylenol is always safer than anti-inflammatories. That's separate from COVID. So if someone has a fever or muscle aches or symptoms that they've been told to treat with an over-the-counter like Tylenol or an anti-inflammatory, Tylenol is always the safest anyways. But if someone is on an anti-inflammatory already for a prescribed reason, we wouldn't necessarily advise them to stop that based on what we've seen so far with COVID. So initially, there were some reports that people on medications called ACE inhibitors or angiotensin receptor blockers were doing more poorly with COVID, and this was a risk factor. We've since learned that this is likely not actually the anti-inflammatory, the blood pressure medications that are causing this issue. It's that sicker people tend to be on blood pressure medications to begin with, and that was the reason that they were seeing this effect. So again, if you are on a blood pressure medication, we advise you not to stop out confirming the safety of these agents. And there's been multiple agencies that have come out confirming the safety of these agents. So please don't stop anything that you've been prescribed.
Is it okay to go to work right now, even if there are only a few people?
So for the most part, the advice has been that if you are in a you do stay at home, and if you can work from home, that you do so as well. If you're in an essential environment and can physically distance at work, so that meaning 6-foot distances, very select situations that it's probably not unreasonable. But again, for the overwhelming majority of non-essential workers, we would want you to stay home, because even in environments where it seems like it's probably easy to distance at work, it turns out that it's not.
Can our food have the virus on the outside of a package? So when, say, grocery shopping?
So I would say that online ordering for groceries is safe, regardless of kind of the high-risk nature of anybody at home. And the approach we've been taking is that when the groceries arrive, yes, COVID, the virus, can live on surfaces for a period of time. So it is best that when you put your groceries away, that you wash your hands right after. If you end up taking the groceries out at some point to make your meal, that it is best to take it out of the package, wash your hands, then start cooking. Where some have recommended kind of putting your food in the fridge or the freezer when you get home. That's, I think, a bit of overkill. You're probably fine with just good hand washing after handling groceries coming from the store.
When do you need to go to the hospital? If you have symptoms but you feel like you can take care of yourself at home, should you notify your doctor?
So I would say that if you're feeling short of breath, doctor, or if you can't get a hold of them, to the emergency department, especially if you're significantly short of breath. Like if you're trying to get through sentences and you can't get through the sentence, that is truly an emergency and you need to be seen ASAP. And it's not a bad idea to, and it's not, as most presentations with kind of mild shortness of breath or cough or fever have been easily managed by your primary care physician. So again, don't hesitate to reach out to them if you have any questions.
That's it for the questions that we've received. But Dr. Mario, you work in a clinic. Are there any questions other than the ones we've asked you that your patients are asking you about the virus?
So the biggest thing I've been asked is, what can we do personally to make the situation better, to make sure we don't end up running out of ICU beds, and to try to get through this as a society as quickly as possible. And the number one thing I've been telling people is, yes, physically distance, that 6-meter barrier, not being in groups, washing your hands, not touching your face, washing surfaces. But the biggest thing you can do is act as if each of us has the virus. So what do I mean by that? If we act as if we have the virus, we'll naturally be more careful about being in each other's bubble. We'll naturally be more careful about hand washing and not touching each other's face. So it does elicit a bit of paranoia in some, you could say. But again, if we pretend as if we have the virus in terms of being extra careful, we'll end up being the absolute safest when it comes to reducing the risk of this virus being spread.
Well, I thank you so much for your time today, Dr. Mario. Thank you for this great information. And thank you to everybody for watching today.
Thanks, Vanessa, for having me. It was an absolute pleasure.
Thank you so much, Dr. Mario, for that great information. And if you have any more questions, you can reach out to us through our Facebook page or our social accounts at RTV London, or directly to Dr. Mario via his social accounts. Again, stay safe, stay home, and we'll see you next time. Thank you for watching. We wanted to also tell you about a new COVID-19 tool that has been developed by family doctors in town with the support of public health and the hospital. You can find the link at lmcovid19.inputhealth.com. If you have symptoms that you wonder might be COVID-19 and you would have otherwise called your doctor to ask them for help, go on the site, put in your symptoms, and it will give you guidance about what next steps to take. If your symptoms require a doctor's virtual visit, the app actually notifies your doctor directly, who will then be in touch with you.